Hello everyone, Dr. Wells here from nutritionalphysicaltherapy.com. Hope you're having a great day. I'm here in my sauna. This is one of my favorite spots to work on some of my joint aches and pains. And we as physical therapists and rehab professionals, we often recommend our clients to use things like saunas and different supplements and exercise for things like osteoarthritis. And so today, I'm going to touch on one supplement in particular that we don't talk about in our courses a lot. So in our board-approved courses, we go into depth in our orthopedic section as well as in our separate section for supplements on osteoarthritis and things that can help, things that are a waste of money and time. And so today, I'm highlighting something that we don't really talk a lot about in those courses, and that's a compound called SAMe. SAMe, which in the chemical formula is S-adenosine methionine. It's a compound that's actually produced in every cell in the body, and particular, it has important roles in production of neurotransmitters and also being a methyl donor. So its role has a lot of variable implications in health, and sometimes SAMe levels can be low, particularly in those that have like liver disease, chronic inflammation, and then possibly with older age as well. So what is SAMe? Well, it has this multifactorial role, but really today I want to focus on the osteoarthritis, its role there. And it has the ability to help produce cartilage by stimulating chondrocytes. And what we're seeing now is emerging evidence that supplementing with SAMe can produce some pretty decent benefits. Now, I will say that these early studies, they're fairly limited in size. Their quality may not be as robust. However, it's certainly piquing my interest because a lot of these are things that we deal with, like knee, hip, and spine osteoarthritis, helps with joint inflammation, stiffness. So a lot of these are compared to anti-inflammatory studies. So me as a physical therapist, I find that a little limiting, right? Because we know that we can provide supplementation as well as exercise, manual therapy, or dry needling, and have these different modalities. So unfortunately, these SAMe studies kind of are limited for us as PTs to look at this and go, well, how much better is this compared to some of the things that I'm already doing in my practice, right? But on a side note, it does have also an impact with depression. So as I mentioned earlier, it has an effect on neurotransmitters, and so it does affect the dopamine system. In my last research update for my 4th of July, I mentioned about methylene blue and having its impact on depression as well. Unfortunately, I think I overstated. I should have said it does not, the effects of methylene blue is not as strong as tricyclic antidepressants. However, with SAMe is as strong as tricyclic antidepressants. So in other words, SAMe may have some benefits with producing more dopamine and serotonin for those that have depression. But what I find interesting is is if it has that effect on depression, so does this drug, I mean, it not only affects cartilage, but if it's affecting depression, are we then sort of treating two different pathways for our patients with osteoarthritis? Because we know that some of them suffer from depression, particularly if they have a painful like knee or hip. They're not doing as much activity and they're not doing as much participation in life, so they may actually be withdrawn and sort of more likely to be depressed, right? So in my opinion, this compound may have some promising studies, and we need to look at how to study this compound through the physical therapy lens. So using SAMe with exercise, with other modalities, and obviously compare it to a placebo, but more to come, and hopefully we can start including this within our courses. As for now, check out our courses, nutritionalphysicaltherapy.com, and sign up today. Have a good one.